We have a very eminent speaker amongst us. He's a very famous personality in Delhi. He's an outstanding gastroenterologist, a scientist, a researcher, a mentor, a gifted teacher. For his exceptional work for his society and the medical field, he is also the recipient of the Padma Bhushan Award by the Government of India, amongst many other awards in his illustrious career. Presently, he is the Chancellor of the Institute of Liver and Biliary Sciences, New Delhi. Please welcome Dr. Shiv Kumar Sarin for his talk on bone diseases as a guest lecture.
Thank you, and I know it's lunch time and I'll be very brief. I'll not take more than 10 minutes, I promise. And the reason for coming is of utmost respect to Dr. Bansal. And I remember his being the Dean of Maulana Azad Medical College and was always very supportive. And I also wanted to give some messages which might be enjoyable for this society. And the last thing before we start, I thought the society may add age management and enhancement. If you add this into your society's thought process, it might be age enhancement, because we all are talking of death of aging. So, and I learned a lot. Dr. Sood's initiative of having started these courses is so nice. And actually, age management starts right at birth, and it is a duty of the parents to see that. Am I visible there? No, that's all right. So I'll not take too much time. So I wanted to start with this concept and give you just in next 5-7 minutes this idea. 1 in 3 Indians has fatty liver. Now actually Delhi Mohalla Clinic 1 in 2. So maybe out of the people sitting here, many would have. And fatty liver can lead to so many problems started from liver. You can have sleep apnea, you can have cardiovascular, I'll come to it, but we are talking about bone disease. Let's start. What is fatty liver? Liver should have less than 5% fat. If it is more than 10%, it is fatty liver. And this comes because of your parents or extra calories. And it changes your gut bacteria. Now, this is not a complicated slide. Just see that you have liver, and each of this is a liver biopsy. Each cell has fat. This is white, means fat. Now this the body does not like. The immune cells come and kill these liver cells. So that is hepatitis. Now this hepatitis is read in your blood by high ALT, SGPT. Then it scars, cirrhosis and liver cancer. Now once you have fat in the liver cell, insulin does not get into the liver. If insulin does not get, pancreas makes more and more insulin every day, every night. And over some time, 10 to 15 years, you get diabetes. Diabetes is a liver disease. I'll explain you how. These are all normal cells. These are fat containing cells. Now there are two people. Both have 95 blood sugar. So you get up, my sugar is 95. This man uses 2 units of insulin and his sugar is 95. This man uses maybe 20 units of insulin every day and he has a sugar of 95. This is insulin resistance. Diabetes is a liver disease. This is a very important message I want to give you. The next is, once you have diabetes or you have this phenomena, you go to a blood test. Sir, इसका तो कोलेस्ट्रॉल ज़्यादा है. सर, मेरा ट्राइग्लिसराइड ज़्यादा है. वो दवाई लिख दी, आपने खाना शुरू कर दी. अब साहब मेरा कोलेस्ट्रॉल ठीक हो गया. But never asking from where has it come. So fat from the liver goes into your blood, and you have high cholesterol and high triglycerides. So everyone who has a high cholesterol triglyceride has fatty liver. Is that part simple, clear? Now once you have high fat, it goes on to your arteries. Your arteries become thick, hard. So you get blood pressure, heart disease, kidney disease, and bone diseases. And all cancers, gallstone, which is a liver disease, and a stroke. So what I am trying to tell you, extra fat inflames the liver and frames your body. So today fatty liver is core to all NCDs. So this was one message which I wanted to give you. Liver fat precedes diabetes, heart disease by 15 to 20 years. So a boy who has fat in the liver by 25 can develop diabetes. We do not know whether fatty liver precedes by how many years bone disease, but it does. But if you already have diabetes, अब मेरा क्या होगा, मुझे तो हो गई. You can still reverse it if you reduce the liver fat. Now, do I have fatty liver? This is my second message. Each one of you today can diagnose sitting here fatty liver. If you or your parents, grandparents had obesity, diabetes, blood pressure, heart, kidney or liver disease, cancers, polycystic ovary, I have fatty liver. It's as clear as that. If my weight, height minus 100, height is 170, my weight should be 70. If it is more, I have fatty liver. For a female, it should be 105, or if there is a family history, then it should be another 5 reduction. So a female with parents having diabetes, a height of 170 should be 60 kilogram. Then you can also find out if your SGPT is high, if your lipids are high, if your sugar is high, and of course ultrasound will pick up in 30% and fibroscan another. So now let us say you have to diagnose in a public, large like Punjab Health University. All diabetics have fatty liver. All overweight have fatty liver. Clear? Now, those who are BMI less than 23, but their waist is high, for female more than 80, male more than 90. BP is high, triglyceride high, A1C is high, or A1C 5.7 to 6.4, better to be 5.7, or family. तो पता लग गया अभी फैटी लिवर है. फिर फैटी लिवर का नेक्स्ट लेवल है फाइब्रोसिस. Whether there is fibrosis in the liver, and this is done by very simple test called FIB4, age, SGOT, SGPT, and you put it into a formula on internet and you get, if FIB4 is less than 1.3, I am okay. If FIB4 is more than 1.3, I may need a fibroscan. This is a fibroscan. The ultrasound wave goes inside. It is attenuated. This is called controlled attenuation parameter. It should be 220. Anything above 250 is fat in the liver. 306 means 30 to 40% of liver is fat. So very easy, 1 minute. Now the fibrosis, it should be less than 6. I won't take time, but anything above 8 is a stage 2 fibrosis. Now comes to little bit about bone. I know you all are experts in this area, but just to give you an idea, the osteoblasts make it, osteoclasts resorb it. And there are two main pathways. I am not an expert, but since we work on this, is that one is the receptor activated NF-kappa B ligand, the rank ligand. This is one pathway, and the macrophage colony stimulating factor MCF is the second pathway, and parathormone, vitamin D and estrogen. I am not showing you many studies, But people who have NAFLD have more of, it favors decreased bone mineral density. Dr. Sood said about gender. So women maintain their bone density while men, as your fat in the liver increases. I told you about 220. So that fellow had 300 fat in the liver. His bone mineral density is down. So fat in the liver will cause this. Hepatic osteodystrophy is the liver causing bones to be weak. And the reasons are many. I will not go into details. I'll just try. You know how to do DEXA. Now management of fatty liver and bone disease. First is change your attitude. यार उसको भी fatty liver है, उसको भी क्या फ़र्क पड़ता है? The first thing, take liver fat as an alarm. I told you about achieving ideal weight, exercise, and all of you, and Dr. Bansal has been telling it, but I want to share this diagram with you. When you eat glucose, in a healthy person, glucose goes to the liver and to the bone, to the muscle. Extra glucose is stored as glycogen and in the muscle also. Now, if you are not moving your muscles, you are sitting like a couch potato, all the glucose goes to the liver, extra glucose is changed to fat and you get fatty liver. But the moment you exercise 45 minutes, 30 to 45 minutes, your muscles become active and no more fat formation. So the principle is, if you exercise, a slide I want to share, to maintain muscles and bone is what you need. After 50, we lose muscles 1% to 2% per year. So if you are 70, you probably have lost 20% of your muscles and your bone will be resorbed. So you should start right at young age and maintain your muscle mass. I'll not go into drugs in detail, just to say bisphosphonates are good for liver patients, and this trial shows you if you give for 1 year that your T scores get better, and zoledronic acid is good. Denosumab has not been much tried, and teriparatide has not been tried. So I'll summarize here just to give you the message. Fatty liver is core and we should realize it. Bone resorption will occur, lifestyle changes and drugs are there, but control fatty liver to prevent bone disease. Thank you for your kind attention.
Thank you, sir. Thank you, sir, for your time. May we please have the dignitaries give a token of appreciation to Dr. Sarin. Uncle.
I hope I didn't bore you too much. Just thought with respect for Dr. Bansal, I am really thankful and I learned a lot about this society.
I'm really grateful to Dr. Shree. He didn't have time to come two times, 3 times, that you can get it on the video, but I refused to accept him. That I said he must come, and I'm grateful to him. Really, he has made the show, and he has given us a wonderful talk. I must appreciate. Thank you.
Thank you. Nice to see you.